The COVID-19 pandemic has touched all of our lives. Healthcare workers have been profoundly affected by it, and they continue to be. DK Wright spoke at length with one Ohio Valley doctor about her experiences, and she joins us now live from the 7 newsroom with this special report.
Catherine, Dr. Jamie Evick is an internist and Vice President of Medical Affairs at WVU Medicine Reynolds Memorial Hospital. She's also a wife and mother. And she not only cares for people with COVID, but she actually had it twice. So here is her story, Lessons from the Pandemic. Dr. Jamie Evick has seen more patients die in the past 2 years than ever before in her practice.
You know, we're used to people passing away from infection, from cardiac issues, but it has, and that usually was maybe one a week. Now it's not uncommon to have 1 or 2 pass away every day.
She says different COVID variants present in different ways. Lately, she sees patients who feel fine at first go downhill later.
A lot of days, it's the day 7 to 14, where the inflammation is so bad and we can't give them enough oxygen to meet their needs. And it's almost like a runaway train. Once we head down that path, it's very difficult to control and to halt the progression.
Despite the well-publicized risk factors of being elderly or immunosuppressed, she finds no rhyme or reason to who survives and who doesn't.
They may have risk factors, but we've had patients, under the age of 40 pass away from it. And I can't look at somebody and say, you're going to be adversely affected by the virus and you're going to be okay.
She sees only one clear indicator.
And I'll tell you, the people that we're seeing that are the sickest are those who are not vaccinated.
Other patients who do recover can come away with long-haul COVID.
They're weak, tired, malnourished. They still have problems with breathing.
Others don't recover. She has to prepare families almost daily to say goodbye to loved ones. This 2-year siege has been exhausting.
I don't know that I have the right word to describe this type of fatigue. It's not just a mental fatigue, it's not just a physical fatigue. Everybody's tired. But this is completely different, unlike anything that I've ever seen or experienced.
Now, as case numbers decrease, she's hopeful but hesitant.
Doesn't mean that there's not another variant lurking around the corner. Doesn't mean that something else isn't going to come. I think the one thing that COVID has taught us is there are no guarantees and we can't really predict what's going to happen next.
Dr. Evick goes home every night to her family, her husband Anthony and their 4 children. Her daughter Avery can always sense when her mom has had a tough day.
And you can always tell when something bad happens at work because she's always just holds us a little bit tighter.
But she still loves her job. Fighting on the front lines of COVID has created close and caring teams.
We still find ways to lift each other up, to make each other laugh. It's, for lack of better terms, forced a unique bond amongst all of us.
Dr. Evick says there is plenty of hope for patients with long-haul COVID. Many hospitals, including WVU Medicine Reynolds, have special rehab programs to help those patients get their energy and vitality back. DK Wright, live in the 7 newsroom, working for you.